Facial volume is a topic that I explain a lot to people because there's a lot of confusion in the literature and Instagram and that type of thing. A lot of volume has to do with, do you have natural volume or do you need augmented volume? Some people, what I like to say is they camouflage instead of correct. And what I mean by that is, if you have the ability to take somebody's descended cheek pad and you can put it back on their own cheekbone naturally with their natural volume, that's much better than taking fat from somewhere else and injecting it around the cheekbone and leaving the descended cheek volume where it is. That's just camouflage. That's not correction. I like to say God gave you everything you need in your face, but gravity, which I kind of joke and say is a devil, and it pulls the volume and it pulls the fatty cushions down. So what we want is your own natural volume in the correct place. That's the goal. So then we have to look at, do you have a slender oval face like the size of an egg or the shape of an egg, where you have a longer face and you need volume in your temples, you need volume in your cheeks? You know, a lot of people also call that a peanut shaped face, which is a little harsh, but really what they're saying is you have certain indentations that have the profile of a peanut. The real goal, and the reason we all think babies are so cute, is because they have a baby face. They have a perfectly round circle with lots of volume. So when you look at a person, there's been many studies that show you look at the eyes first, you look at the mouth second, and then you look at a combined eyes and mouth, the center of the face third. The center of the face, that circle, is the goal. So if you look at a skull and you look at the different things that make up shape, you've got the orbits where the eyeball sits. You've got the mouth, which is a pretty large cavity. And this is where all the action is. That is what I call the oculus. It's a three-dimensional circle. So when you're looking at a face, you're approximately looking at the center circle, the size of a softball, and that's where you get all your emotion from. So the reason that anybody's even interested in getting a facelift is they want to enhance that center oculus. So we want to first take your natural volume and replace it and restore it. And the best way to do that is to work on the facial ligaments, which are holding that volume and preventing you from moving it back to a good position. So when somebody, like say a dermatologist, goes in and they inject fat all around, it's camouflage because you're not moving your natural volume where it belongs. When a surgeon goes in and they do an old-fashioned facelift from the outside and they just stretch everything, same thing. It's compressing the fat. It's given that kind of joker pull because it's not moving the volume. It's just compressing and stretching out the wrinkles. If you want to put your volume back where it belongs, that's what it takes to have a natural look. You want to look like yourself. I like to always say the goal is to look like your daughter, not your next door neighbor's daughter. And a lot of people look like their next door neighbor's daughter. After surgery, they look different. The reason they look different is because they didn't have their natural tissues put back in the natural position that they were born with. The best way to do that is from an inside out approach, where you're loosening the ligaments and you're allowing this layer called SMAS and the volume to be moved to the proper position and then secured. And once that's done, then you have a natural appearance where all the focus is in that center circle when you look at somebody. that encompasses the eyes and the mouth. So you either look at their eyes or the mouth, that you alternate between those two, or you focus on that center circle, which in a three-dimensional way is called an oculus.